expanding advance premium tax credits, and continued support for rural health providers. I am proud of the Biden-Harris administration for taking the necessary steps to close the coverage gap in this country. As a representative of Alabama's 7th Congressional District, a district with high rates of chronic diseases, yet in a state that has not expanded Medicaid, closing the coverage gap remains a top priority for me. The advanced premium tax credits were established by the Affordable Care Act, and thanks to the American Rescue Plan, more Alabamians can benefit from this tax credit. Prior to APRA, the consumers with household incomes above $400,000, 400% of the federal poverty line were excluded from qualifying for these tax credits. But in 2023, almost 240,000 Alabamians enrolled in the Marketplace health plans received the tax credit. This means that more citizens in my home state, which did not expand Medicaid, can afford health care. This is really unprecedented and necessary in states that did not expand Medicaid. So my question to you, Mr. Secretary, is with the advanced premium tax credits being vital to reducing the coverage gap, is your agency committed to working with Congress to expand and extend this subsidy expansion beyond the 2025 timeframe?
Congresswoman, that's a priority of the President's, yes.
Absolutely. I also remain committed to supporting the hospitals in my district. I applaud the Biden-Harris administration for the new option available to support rural hospitals through rural emergency hospital conversions. Just Monday, I spoke about the challenges of access to emergency medical care in my district. Issues from hospital closures to low ground ambulance reimbursement rates have really caused a problem all across this nation, and it was just exacerbated during the COVID-19 crisis. So, Dr. Becerra, can you share how the new rural emergency hospital designation has been helping rural hospitals provide emergency care? And beyond the $5 million in technical assistance, how is your agency helping to expand this designation in communities across this country?
Congresswoman, the new designation, it becomes very important for rural emergency hospitals because it gives them enhanced support. We know that if some of these facilities are going to survive, we're going to have to do something differently because they provide that critical care, and it's oftentimes very expensive care, and it's not something that a facility can rely upon having at all times. So it's a very difficult financial proposition for a lot of these facilities. We're hoping that this new designation, Rural Emergency Hospital, will help them survive in a place where if they were to go, then families would really be in a hurt.
Not just families, whole communities really depend upon these hospitals. So I wanted to say hats off on this designation and do everything you can to try to expand that. Thank you. I yield back the balance of my time.